Skin cancer is on the rise, especially among young people. That's important to keep in mind. And South Mississippians are spending more time outdoors with this spring and this summer. Karen has more on this tonight on our Health Watch Report.
Thanks, Jeff. Well, it is a good time to remind people about the dangers of the sun's damaging rays on our skin, which is really an issue year-round in South Mississippi. Tonight, we look at some of the basics of sun protection for your skin.
So this mole has been what's changing, is that right?
Yeah, it's gotten a little darker over the past few months.
Dermatologist Dr. Jacqueline Sasaki takes every skin checkup very seriously, no matter what age her patient is.
Much of the damage is before we're out of childhood, certainly by the age of 18. In fact, 1 or 2 blistering type sunburns before the age of 20 increases your risk of melanoma significantly.
Melanoma is the most dangerous and potentially deadly form of skin cancer, and it is preventable in most cases if people use what Dr. Sasaki calls the ABCs of skin protection, starting with A for avoid.
By avoiding the most dangerous hours of the day, which is 10 a.m. to 4 p.m., that's when the ultraviolet rays are the most dangerous.
B is for block.
You want to be using protective hats, sunglasses, as well as tolerated protective clothing. For the areas that you can't cover, you want to be using as high of an SPF, sun protection factor, sunblock as you can tolerate.
And C is for cover.
And you want to be applying for the full body a full shot glass. For the average adult, a little bit less for a child, but not much less.
Sasaki says if you have any spots, sores, or moles on your skin that are new or have changed in appearance, you should have them evaluated.
Melanoma, when caught in the early stages, the thin stages, the 5-year survival rate is over 95%.
And she says remember to start early.
I think people take it seriously when they're older and wiser. Unfortunately, the young people are the ones that need to take it most seriously because we know that the cumulative damage acquired by the age of 25 especially is most dangerous for at least the most deadly type of skin cancer, melanoma.
And Dr. Sasaki says most people would be pretty surprised if they knew just how many young people she diagnoses with skin cancer. In fact, she recently had 2 college students who had to take a year off of school because of numerous surgeries and treatments for their skin cancers.